Prime Minister Narendra Modi to address the nation this evening on COVID-19 menace, even as total number of confirmed cases rises to 492. Election Commission defers Rajya Sabha elections in view of prevailing public health emergency scenario. Assam Chief Minister Sarbananda Sonowal appeals to people to stay alert, maintain social distancing as the state heads into a lockdown. Meghalaya Chief Minister Conrad Sangma says next 10 to 12 days are crucial for the state in its fight against Corona challenge. And Information and Broadcasting Ministry asks all states and union territories to ensure operational continuity of print and visual media. Good evening viewers, welcome to the Northeast News Bulletin. This is Satwati, now with the details. In national news first, Prime Minister Narendra Modi will address the nation at 8 p.m. today. In a tweet, Modi said he will speak on vital aspects relating to the menace of COVID-19. This will be the Prime Minister's second address in 6 days of the outbreak. The Prime Minister had stressed social distancing as a necessary measure to contain the spread of the novel coronavirus. He advised those over the age of 60 to remain inside their homes. Modi gave 9 calls to action, urging everyone to avoid stepping out of home unless absolutely essential. He said people should avoid going to hospitals for routine checkups. On the economic front, Prime Minister announced formation of COVID-19 Economic Response Task to comprehensively look at ways to boost the economy. He also asked people to not cut wages of those working in homes, support staff, drivers and gardeners. He assured that the country has enough food and ration supplies and asked everyone to stay away from rumors. Meanwhile, the total number of confirmed cases of COVID-19 rose to 492 in the country with 9 deaths. Union Ministry of Health and Family Welfare has confirmed that 37 patients have been cured and discharged so far. The Indian Council of Medical Research (ICMR) has said that more than 20,000 samples from 19,817 individuals have been tested in the country so far. A study done by the ICMR has showed that strict implementation of preventive measures like social distancing, home quarantine of symptomatics and suspected cases will reduce the overall expected number of cases by 62% and the peak number of cases by 89%. It also exhibited that entry screening of travelers with symptoms suggestive of COVID-19 can delay the introduction of the virus into the community by 3 days to 3 weeks. On the other hand, the World Health Organization has warned that the novel coronavirus pandemic is clearly accelerating, but said it is still possible to change the trajectory of the outbreak. The remarks came as the number of deaths soared past 15,000 with more than 341,000 people infected worldwide, according to a tally compiled from official sources. World Health Organization Chief Tedros Adhanom Ghebreyesus told journalists in a virtual news briefing that it took 67 days from the beginning of the outbreak in China in late December for the virus to infect the first 1 lakh people worldwide. In comparison, it took 11 days for the second 1 lakh cases and just 4 days for the third 1 lakh cases. The number of cases is believed to represent only a fraction of the true number of infections, with many countries only testing the most severe cases in need of hospitalization.
Silent killers are eliminating them in the country. Smallpox, one of the greatest successes of mankind, a virus that killed more people on this planet than all the wars put together. India, through targeted public health intervention, ended that disease and gave a great gift to the world. India.
In another development, Election Commission has deferred Rajya Sabha elections scheduled to be held on the 26th of this month. The decision has been taken in the wake of current situation and lockdown imposed due to the COVID-19 outbreak. The election to fill up 55 seats in the upper house was to be held on the 26th of March, but 37 candidates have already been elected unopposed. Now election was to be held for remaining 18 seats. The Commission said it has reviewed the prevailing situation of public health emergency in details and deferred the polls. Fresh date of poll and counting for the biennial elections will be announced in due course after reviewing the prevailing situation. Moving on to Northeast now, Assam Chief Minister Sarbananda Sonowal today said that as responsible citizens, it is imperative that people stay alert and cooperate with the medicos. In a tweet, Sonowal said, and I quote, "Underwent screening at Assam Legislative Assembly, Guwahati, as we head into a lockdown from this evening. I urge everyone to wash their hands frequently and practice social distancing in these trying times." Unquote. In more news from Assam, the State Assembly today passed the Assam Appropriation Bill 2020 as soon as it was presented in the House. Finance Minister Dr. Himanta Biswa Sharma said this bill was a necessity for the state's financial health. Dr. Sharma, who also holds the Health and Family Welfare portfolio, informed the House about some important decisions for tackling the COVID-19 crisis. Among them were the upgradation of Sonapur Hospital and an understanding with some private sector hospitals. The Assembly was adjourned sine die today.
সেইকাৰণে আমাৰ কোৱা হৈছে যে আধা ঘণ্টাৰ মূৰে মূৰে সাবন আৰু পানী দি যেতিয়া হাতখন ধুই থাকিম, হাতৰ ওপৰত সাৰফেচত যেতিয়া অলপ ইয়াত মক্ষিণ হৈ থাকিব, সাৰফেচখন খুব স্মুথ হৈ থাকিব, তেতিয়া ভাইৰাছটো আহি হাতত বহিব নোৱাৰে। আধা ঘণ্টাৰ মূৰে মূৰে, 1 ঘণ্টাৰ মূৰে মূৰে যদি আমি হাতখন ধুই থাকিম, খুব বেছি কনসার্ন হব লাগিব যে এতিয়া মোৰ মুখত হাতখন চুব ইচ্ছা গৈছে, নাকত হাতখন চুব ইচ্ছা গৈছে, তাৰ আগতে হাতখন ধুই পেলাইহে আমি নাকত নিব লাগিব।
In news from Meghalaya, Chief Minister Conrad Sangma has said the next 10-12 days are very crucial for the state as a whole in its fight against COVID-19. The Chief Minister took to Facebook and urged people to maintain social distancing. He said the government is doing everything in its capacity to ensure that people of the state are safe from the virus, asking people who have come from outside the state to voluntarily inform the government about their arrival. He also took questions from the citizens about the steps and measures the government has taken to break the chain of the COVID-19 spread. The Tripura government has clamped a lockdown in the state from 2 p.m. today to prevent spread of the novel coronavirus in the state. Addressing a press meet at Civil Secretariat, Chief Minister Biplab Kumar Deb said the government has decided to impose a lockdown which will continue till 5 p.m. on March 31. During the lockdown, banking services, food market, grocery shops, medicine, milk, cooking gas and fueling stations will remain open. In Meghalaya, although the citizens of Shillong have upheld the precautionary measures taken by the government in the fight against COVID-19, yet concerns are being expressed for those who survive on daily wage. The state government has adopted a 1-day open and 2-day shutdown strategy to counter the spread of COVID-19. Not just this, the interstate and interdistrict public mode of transportation have been suspended. It has allowed only 25% of local cabs to ply on certain days. Doctors and nurses on the front line of the coronavirus crisis have issued a direct appeal to the public. A group of respiratory consultants in Belfast in Ireland have appealed to the people to stay at home and stay safe.
I'm Nick and we are the Belfast Respiratory Team. We are now in the greatest medical crisis of our lifetime. Stay at home.
I'm Angela, one of the respiratory consultants. This is the crucial time. This is not a rehearsal. You will only have one chance at this. Stay at home.
I'm Claire. I'm a respiratory nurse. You can play your part to enable us to play ours. Please stay at home.
I'm Julian, a respiratory consultant. We all have a choice. If you choose to stay at home, you will save lives. Please, stay at home.
I'm Susie. I'm a respiratory consultant and I've been a doctor for 35 years. We are facing our greatest challenge and we're frightened. Help us. Please stay at home.
I'm Siobhan. I'm a respiratory physiotherapist. I know where my kids are. Where are your kids? Keep them at home. Stay at home.
I'm Roshing, a respiratory nurse. Doctors and nurses have died. We need to stay healthy so we can help you. You can help save our lives. Stay at home.
I'm Anne-Marie, respiratory nurse consultant. Thousands of people could die here. Help us reduce that number. Play your part. Save a life. Stay at home.
My name is Thelma. I am a respiratory consultant. You've heard my colleagues. This is a crisis. Please stay at home. We beg you.
The Ministry of Information and Broadcasting has directed all states and union territories to ensure operational continuity of print and electronic media in view of the coronavirus outbreak. In a letter to all chief secretaries of states and union territories, the ministry said robust and essential information dissemination networks at this juncture are of utmost importance to ensure timely and authentic information dissemination. It said the proper functioning of these networks is required not only to create awareness among people and to give important messages, but also to keep the nation abreast of the latest status. The ministry said false and fake news should be avoided. In Manipur, the All Manipur Working Journalists Union AMWZU has announced an advisory against all kind of press conference and public gathering at the Manipur Press Club in Imphal amid the global coronavirus threat. 6 resolutions were adopted during an emergency meeting held by AMWZU and the Editors Guild Manipur EGM. The union also advised reporters and correspondents to refrain from attending press meets called by any individuals or organizations for their own safety. That brings us to the end of this evening's bulletin. Thank you for tuning in. Namaskar.